Welcome to this presentation about sustaining hand hygiene for all in South Asia. My name is Nicole Klaesener-Metzner and I work for UNICEF's Regional Office South Asia. I'm presenting today in the name of my two co-authors, Peter van Maanen and Sue Cavill, as well as myself. What you see in front of you is a snapshot for South Asia based on joint monitoring program data covering the SDG 6. What the data says is that by 2030, at the current rate of progress, South Asia will reach 95% of its population with basic drinking water and basic sanitation service. A quadrupling of efforts is required to ensure universal access to basic hygiene services at home, though. At current trends, only 75% of the population of South Asia will have access to basic hygiene services by 2030. Hand washing, as we all know, is one of the most effective measures to prevent the spread of COVID-19 and has been adopted by governments around the world as a key strategy to prevent the spread of the virus. In 2021, the South Asia region accounted for half of all new known COVID-19 infections globally. Data from the Joint Monitoring Program shows comparatively low levels of hand hygiene access in the South Asia regions, with 4 in 10 homes lacking a place for hand washing with soap prior to the pandemic. This presentation reviews experiences of hand hygiene in response to the COVID-19 outbreak. It provides a regional stocktake of hand hygiene promotion, products, facilities, and services, as well as monitoring and highlights where more action is needed to achieve sustained hand hygiene for all. The paper is based on a regional market assessment of soap and sanitizer sales in the region, a literature review of regional innovations in hand hygiene products and services, including new climate-resilient devices, mobile phone-based behavior change methods, and innovative monitoring tools, as well as an online survey of about 200 regional wash professionals on hand hygiene in public places, especially in denser urban areas in 6 South Asian countries. The reliability of hand hygiene data is obviously key to be able to implement evidence-based programming. The need to develop effective hand hygiene strategies, policies, and interventions based on high-quality data and information is urgent. With the COVID-19 pandemic, public places, especially in denser urban settings, have become an increasingly important location for hand hygiene facilities. Challenges to the functionality of hand hygiene facilities include management and accountability, behavior change, and financial resources. Efforts to change hand hygiene behavior must be supported by a reliable and sufficient supply of water to achieve sustained and universal hand hygiene practices in public places. Our short online survey of about 200 regional wash professionals did result in 3 key insights standing out. A large share of all those hand washing stations that were implemented in response to the COVID-19 pandemic, after about a year or within a year of installation, a large share of those were not fully functional anymore. We have issues providing inclusive access to all in public places, and monitoring of hand hygiene facilities in public places is non-existent or at best piecemeal. In regards to monitoring during the COVID-19 pandemic, obviously remote monitoring efforts have been instrumental to be able to generate data. Mobile phones have been used to promote hand hygiene as well as monitor the functionality of hand hygiene facilities via text messages, hand hygiene apps, WhatsApp messages, YouTube videos, and phone calls. Phones have served as remote instruments that can generate reliable coverage data on hand hygiene, as you can see on this map that highlights the disparities that exist within one province in Pakistan in terms of access to hand hygiene facilities. In UNICEF's effort to create evidence and support the development of evidence-based hand hygiene programming, UNICEF has initiated market-based approaches to strengthen its hand hygiene interventions. Given that reliable hand hygiene data is notoriously hard to gather, as we often rely on self-reporting as well as sparsely collected data from public spaces, we have trialed out the usefulness of data of product, market intelligence, and retail measurement. Those data, tracking sales data and generating market intelligence, can provide evidence for and inform the design of new hand hygiene programs and interventions, assisting in managing ongoing programs and services, as well as improve the monitoring of hand hygiene uptake if data is used in combination with the data generated by the programs itself. A mismatch of information or a just pure lack of communication between the two players, market intelligence providers, as well as the development sector, makes that this data, this wealth of data, is currently not persistently used. In addition to data creation, evidence creation, data collection, market-based programming, it is important to build the enabling environment for hand hygiene for all. This was done through joint efforts of a variety of partners through the Hand Hygiene for All global initiative under the co-leadership of UNICEF as well as WHO, which was launched in 2020 to support the response to the COVID-19 pandemic. It is based on the logic that hand hygiene makes good economic as well as social sense, protects against COVID-19 as well as a wide range of other diseases, and therefore is one of the key interventions that governments can deploy to protect their populations. Country roadmaps laying out the pathway to achieve universal hand hygiene in each country worldwide have been developed by a variety of countries, with this example for Pakistan that you see in front of you being the first globally fully fledged costed roadmap for hand hygiene for all being developed and implemented. In addition to the enabling environment on a policy level, again, it is important to understand the data at hand. A quadrupling of efforts is needed for basic hygiene within SDG 6, including hand hygiene for all, by 2030, and costed plans enable the targeting of existing finance for hand hygiene also provide the basis for additional investment, as well as an engagement with the private sector and all other relevant stakeholders. In conclusion, the key insights from the market assessment, literature, and regional survey reveal that phone-based hygiene promotion has a very limited impact on sustained hand hygiene practices. A large share of hand hygiene facilities in public places in South Asia are unfortunately no longer fully functional within a year of installation, and their functionality is rarely properly monitored. Providing inclusive access to facility and soap is a major challenge. We need to deploy a leave no one behind agenda. The availability, affordability, and use of soap is one of the biggest barriers to the uptake of hand hygiene. And the monitoring of hand hygiene supplies and facilities in public places is piecemeal, but promising innovations include crowdsourcing data, modeling and citizen reporting, product and consumer research data that is currently underused. Thank you very much, and I'm looking forward to answering questions in the live Q&A.